Hello, I'm Craig Stern from Pharma Pharmaceutical Consultants. We spoke in a prior communication about utilization as kind of that hidden factor that we don't frequently talk about that has to deal with driving costs, driving the number of prescriptions that people use, etc. But we need to kind of put a benchmark to it. We need to deal with the basement. And that is, in the past, we talked about the drug cost times utilization has to do with our overall spend. We've identified that drugs need to be appropriate and then also inappropriate and are viewed. Let's talk for a moment, where does utilization come from? We know that utilization comes from more patients who use more prescriptions. And as people get older, they use more prescriptions. They have more diseases, they have more particular conditions, and they need prescriptive medication. So the real fundamental problem that we have is, one, what is a natural kind of number? So we have some idea as to whether the number that we're seeing with regard to utilization, the number of prescriptions for every patient, whether that number is too high or too low. Clearly, one can follow the number of prescriptions that are being sold at individual pharmacies, and there are numbers for those that give some sort of a trend. And it doesn't vary a huge amount from week to week, month to month, etc. And if our population increases so that we have a lot more patients or a lot older patients, we know that our overall utilization will increase. The challenge for us is, are people getting appropriate medications? Now, what does appropriate mean? How do you define that? The reality of it is appropriate is different depending on the age group. An older population needs to have diseases that are endemic in that population treated. It is not a good idea not to treat things. That's a really bad idea. At the same time, we want to make sure that drugs that are being used appropriately, and we don't effectively have good drugs gone bad. So one of the things we do is to make sure that we have checks on that, and if there are no checks on appropriate and inappropriate, utilization effectively acts as the multiple every time someone uses a branded prescription or a generic prescription. Well, there has to be some measures for that, and the reality of it is there are. In elderly population, there are kind of target lists of drugs that may be appropriate in some indications, but in older people, no. In younger people, there are indications for drugs that should be used, and yet if they're being used, if they're using market-based drugs versus drugs that national guidelines have identified, then it's inappropriate. So our real challenge here is to look at medications, identify how physicians are prescribing, and differentiate between a market-based approach and a non-market-based approach that is based on evidence, based on national guidelines. Those national guidelines are what professionals like myself use in order to address it. And at the end of the day, if we're not using those, and if there are no criteria that you have, whether they're in your contract or your programs, then there's a problem. I hope this has been of use. I look forward to speaking to you again.